Hi, good evening. My name's Nazia. I'm the Diabetes Specialist Nurse for Connect Healthcare. Warm welcome to everyone and thank you for joining us this evening. This session is about the NHS Type 2 Diabetes Remission Programme. The session really is about giving you clear, honest information about Type 2 diabetes and the remission programme and how the NHS can support its patients and to explore their options in terms of weight management and optimising diabetes care. So hopefully what we're planning to cover today is, we'll talk about what type 2 diabetes is, followed by what remission means and what it doesn't mean. In addition to that, we'll look at how weight loss can help and what the NHS remission programme entails and how you can access this service. As I said, it's an information session. There's no commitment required to join. The session's just the aim is really to help you to understand your options and to make informed choices. So, why does type 2 diabetes matters? It's a common condition. Many people tend to live well with type 2 diabetes, but over time, particularly if it's not looked after, Hi, so why does type 2 diabetes matter? It's a very common condition. Many people tend to live really well with type 2 diabetes, but over time it can lead to complications, particularly if it's not managed well. Some of the complications can be around, it can affect the heart, the kidneys, the nervous system. It's often linked to weight and insulin resistance, which the good news is with the right support in place, you can regulate your blood glucose levels and they can improve significantly. So how common is type 2 diabetes? Well, in Rotherham itself, 1 in 14 people have diabetes. Most people tend to have type 2 diabetes and the numbers are increasing every year. It's not just a Rotherham issue, it's a national concern and also a global issue as well, as the numbers are significantly climbing. So what is type 2 diabetes? So very simply, the body's inability to control its blood glucose levels. Usually the insulin isn't working as well as expected, and over time, because the insulin's not working, it causes the blood glucose levels to rise. Type 2 diabetes isn't caused by one thing. There's several things that may influence this, such as weight, genetics, lifestyle, age. They all can play a role. So what is diabetes remission? Now, remission means when your blood glucose levels return to normal range, no diabetes medication is needed, and you'll maintain this state for at least 6 months. Remission doesn't mean the diabetes has gone forever. It means that it's well controlled without the medication, as long as you maintain the healthy habits long term. I often tell my patients that once remission has achieved, however, if, for example, the weight returns or you gain weight, you'll trigger type 2 diabetes again. So it's very important and paramount that you maintain the weight loss, you maintain the habits that you've developed during the course of the program. So is remission possible? It's possible for some people. It's usually beneficial for those who have been diagnosed with type 2 diabetes early on. What the key factor to achieving remission is the weight loss. Not everyone will achieve remission, but that's okay. Most people still benefit through better control with their diabetes and having fewer medications. So what does the evidence show? Within the UK, the direct trial was one of the largest trials that was conducted. Nearly half of the participants achieved remission over 1 year, and the greatest success was their weight loss. On average, we're looking at between 15 to 17 kilos of weight loss when they've completed the 12-month program. The program itself is based on solid research. It's not on any trends or any fads or any quick fixes. So how does the weight loss help you to achieve remission? Well, there's a number of things. The weight loss helps you to reduce the fat around your liver and your pancreas, which in turn then helps the body's own insulin to work more efficiently or better, which then in turn lowers the blood glucose levels. Even modest weight loss can make a real difference to your blood glucose control. So what is the NHS remission program? The program is funded by the NHS. It's an intensive weight management program and it's delivered by trained providers. It's nationally commissioned by the NHS program. It's not private or neither is it commercial. So there's no cost to the patients that are on the program itself. So the question is, who is the program for? So there is a criteria. It's now opened up to patients who are 18 years or above who have type 2 diabetes, usually diagnosed within 6 years of their diagnosis. They have to have a BMI of more than 27, and if you're from the BAME population, usually a BMI of more than 25. You must have attended your diabetes review within the last 12 months, and that also includes your diabetes foot assessment as well as your diabetes eye screening. And the key thing is willing to engage. That's a key factor to the success of the program and for patients to achieve the outcomes that they want. The eligibility is all about safety and the likelihood of its benefits. So who is it not for? So anyone who's currently taking insulin, anyone who is pregnant or planning for a pregnancy within 6 months, anyone who's currently breastfeeding, particular certain eating disorders, anyone who's had a heart attack or a stroke within 6 months, anyone with severe renal failure or an active liver disease. This is not an exhaustive list. The key issue here is ensuring that you're safe on the program, that you meet the criteria, and for those who don't meet the criteria, that's not the end of the road. There are alternative programs we can discuss with you later. So how does the program work itself? Well, the program really entails, it's 12 months as I said, and it's broken down in 3 phases. The first phase is usually total diet replacements. This is then followed by food reintroduction, and the last phase is the maintenance, the long-term maintenance of the weight loss that has been achieved. The program is structured and it's fully supported by a coach who works with you on a weekly basis throughout the program, so you're not alone, and hence the high intensive support is a cornerstone for why patients find this really successful. So just to drill into more detail about phase 1. Phase 1 is usually around 12 weeks where you come off your normal diet and you're provided with meal replacements. These usually include food, soups, shakes, porridges, and you have close professional support. It's the intensive aspect of the 12 months, but however it's time limited, it's 12 weeks. And then it's also important to ensure that you're safe on the program. So prior to commencing, we ensure that your health checks are done. Before you commence the program, we adjust any medication safely, and ongoing support is provided throughout the program. Safety is the priority, and any medication changes are planned and monitored. So when you come to the end of phase one, you go into phase two. Phase two is when we start to reintroduce food slowly. So gradually it's returned to everyday foods, and portion guidance is encouraged and continued support. So during your phase one, when you do work with your coach, you are provided weekly support and guidance, and you're also developing skill sets around food and nutrition, lifestyle changes, physical activity, and all of these come into play when you're in phase two, when you're reintroducing food. So you'll be selecting and making choices that are positive to your weight loss that you have achieved. And this phase really helps you transition back to normal eating. And as you come to the end of phase two, then you're ready to go to phase three, which is the maintenance stage, the last stretch of the program. This is about really building those long-term habits, consolidating when you're learning, encouraging and continuing with the physical activity that you may have successfully achieved, and also preventing weight regain, and keeping keeping benefits, maintaining the long-term benefits. So how is this program delivered? Right, there's a number of options available. The program itself can be offered face-to-face. Usually it's at a clinic near to where you live, or registered, or to the GP practice that you're registered with. If that's not suitable for some people who can't attend face-to-face clinics, then we offer digital options. So it's either a virtual video call, or you can have a telephone support, but the regular support contact continues throughout the whole program. So what would be the benefits of taking part? We've mentioned some of them, but potential benefits would be you'd improve your blood glucose levels, you'd reduce or stop some of the medication that you had been initially prescribed. It also increases your well-being, and you tend to feel more energetic. People often notice the benefits beyond diabetes alone. Is it right for everyone? Success looks different for different people, and it's important to know that not everyone will achieve remission. So in my experience, when we've had the opportunity to talk to patients, some of them have had significant weight loss, but remission hasn't been achieved, whilst others have lost the weight and they have achieved remission. But the results really vary between the individuals, and it really depends how your progress or how your experience has been on the program. So support continues even if you don't achieve remission. That's a key factor. So how to find out more? The key thing I really encourage everyone to do is have the conversation with your GP or your practice nurse. Talk to them about the NHS Pathway Remission Programme. And if you decide this is right for you, they can email the Connect Healthcare team. We'll provide the contact details later on the programme. There's no pressure. What will usually happen is that the team from Connect Healthcare will contact you, they'll arrange an appointment with one of the diabetes specialist nurses, and you'll have the opportunity to discuss the programme in detail and then decide whether this is the right programme for you. The key messages really are that the NHS Type 2 Diabetes Remission Programme definitely improves diabetes outcomes for its participants and patients. Remission is possible for some people, and the NHS offers the structured support throughout the whole 12 months. So the important thing is that support is available. I would like to probably add at this point that not everybody may be encouraged or entitled to do a 12-month program, and if you feel that that's not ready, if you're not ready for such a program, or you want something medium intensity, or you don't meet the criteria, there are alternative options. So we have what we call the Desmond program. Usually it's a one-off session offered to patients who have newly diagnosed with type 2 diabetes. It's a whistle-stop tour. It's 6 hours, which goes through needle and thread in terms of what diabetes is, what would be the short-term, long-term complications, healthy eating, and how to look after yourself in diabetes. The other programs that we have is called the Better Eating for Type 2 and You in Diabetes. And this is a structured program. It's 10 weeks. Patients can achieve anything between 10 to 15 kilos, and it's making small changes to your current lifestyle. In addition to that, we have the digital weight management program, and that's for patients that particularly like to do things remote, and like to self-manage and do things independently with minimum coaching. And if you find that these programs are not suitable, I still encourage you to have the conversation with your GP, your practice nurse. There are other programs that you can, particularly, there's other programs that you can tap into. So I'd like to say a big thank you for listening to me. I'm happy to answer any questions to clarify anything that we've covered today. So we have a question, is there an age for diabetes program? Yes, so anyone who's 18 years or above who has type 2 diabetes, recently diagnosed within 6 years from the diagnosis, can apply for the program. They've actually lifted the cap, so now it's available to anyone who's above 18 years of age, as long as you meet the eligibility criteria and it's safe for you to complete a program like the remission program. Just having a small problem with the question with my iPad. Okay, yeah. Can we pause it? Hi, so there's a question about asking about patients that have type 1 diabetes. The program is only available to those who have type 2 diabetes. And we've got another question, it's asking about, is there face-to-face groups for type 2 diabetes? There's a number of options available. So in terms of the NHS remission program, that's not done as in group settings as for now. That's usually done one-to-one. The Betty program is offered as a group, structured group support. The Desmond program is also offered as a group support. Yeah, so we have a question, does it cost anything? No, the program itself doesn't cost, there's no cost to the patients whatsoever. It's funded by the NHS. We have another question about, is anything similar for type 1 diabetes? Type 1 diabetes, in terms of weight management, I'm not aware of any weight management programs. However, they tend to be offered something called the DAPHNE course, which is the dose adjusted for food. So something that you probably, if you're interested in structured education for type 1 diabetes, I'd encourage you to speak to your GP, your practice nurse, or if you're linked with the hospital team, to have a conversation with the diabetes specialist nurses at the hospital. Does anyone have any other questions? So if there's no further questions, or you can't think of enough, if you can't, if the questions, if the questions you want to ask later on, please email them. We will be sharing a blog post with the email address for the Connect Healthcare, and then you can forward your questions or queries to the email address. I'll be more than happy to respond to you. So thank you.